Hello, I am Marwan Abourass. I prepared this video to introduce you to the mnemonic precision. I have developed this approach to help in the radiographic assessment of substandard or technically inferior endodontic treatments. What factors contribute to these inferior treatments? What clinical actions lead to them? The mnemonic precision is designed to answer these questions and dissect the root causes of unsatisfactory endodontic treatment or results. It's crucial to understand that substandard endodontic is responsible today for the whopping 53% prevalence global of AP associated with substandard endo, which we're talking about. Now, endodontic treatment being a foundation for crowns, veneers, orthodontic treatment, maxillofacial surgery, or next to implant dentistry, it has to be good quality. Quality is indispensable. So with the precision concept and a good head-on PA and a bite wing, we can answer these questions. The approach is solely for the evaluation of pure endodontic treatment. We're not going to discuss systemic diseases and whether there are available training or no training, instruments, no instruments. We're going to focus on the quality of endodontics. Okay? So let's get into it. Precision. The P stands for preparation. Lack of thorough canal enlargement prevents the elimination of infected dentin, which hinders effective canal disinfection. Additionally, it comprises the very important three-dimensional obturation, three-dimensional preparation, and obturation. Substandard endo looks faint, vague. Attempted treatment. The image of good standard endo is powerful. It's bold. It's definitely opaque. The second letter is R. R is for root itself, the root in question. It should be the one we focus on. The questions that need to be addressed include whether all the canals have been treated. Are there any perforations? Perforations are responsible for 9.6 failure rate. Are there any broken instruments that prevent the completion of endodontic treatment? What is the size of that fractured instrument? Where is it? What's location? E is for elimination. It's necessary to ensure that all vital and necrotic tissues have been removed from the root canal system, including the chambers, the canals, the fins, the fissures, the lateral accessory canals. Failure to eliminate encourages bacteria growth and leading to AP and tooth discoloration. The lack of thorough canal enlargement prevents elimination. The next letter is C for complications. Complications that lead to substandard endodontics are imaged, such as incomplete obturation, gross short filling. This is responsible for 88% of the failure rate according to the Washington study, the classic Washington study. Almost 59% of failures are caused by short fillings. Also, you could have overfillings with cements, zinc oxide, eugenol, formaldehyde, calcium hydroxide. These overfills also are indications of substandard performance. Some of them toxic, some of them resorb, some of them don't. Today, resin and bioceramic overfills are slow in resorbing, but the good news, they are not toxic. They are not toxic, such as calcium hydroxide overfills, for example. Then comes the letter I. I is for improper neighbor, improper restorative and prosthodontic treatment. These are always neighbors, sometimes good neighbors, sometimes bad neighbors. It's easy to observe. You see restorative problems such as horizontal or vertical discrepancies, open margins, long posts that destroyed the gutta-percha apical seal, posts that perforated the walls of the root canal, screw posts that fractures teeth. All the above either compromise the endodontic treatment or promote coronal apical microleakage and the development of AP. After that is the letter S. Structural strength of the tooth. You cannot evaluate the structure if you have a crown. Crowns, defective crowns, have to be removed so we could examine the tooth structure. Cracks, erosions, hidden cracks present a significant challenge in clinical dentistry. And the only structural damage which we can image with some degree of certainty is the root fractures, complete root fractures, and with periapical lesions, of course. The I stands for ignorance. Ignorance in case selection factors. The Washington study reported 22.12% endodontic failures caused by overlooking case selection factors, performing endodontics on treatments when it is not indicated, like periodontal disease, contributory cracks, teeth with cracks, teeth with resorption, teeth with palatal grooves. Remember that the best practice to prevent the wrong selection is, again, my 4R operational diagnosis protocol, especially in the context of endodontic periodontic pathologies. Then we come to the letter O. Occlusion. Occlusion, traumatic occlusion affecting the endodontically treated teeth, can contribute to the periapical and periodontal tissue breakdown and the development of AP and marginal periodontitis too. Moreover, para-occlusal forces can also initiate cracks. The last letter in precision is N. N is for negligence. Observed in endodontic treatment failure is a result, many things result of negligence. Overfilling, underfilling, perforations, overlooking canals, fractured instruments are all the results of negligence. Therefore, always keep in mind precision. During endodontic treatment performance, remember, success of a treatment depends on attention to details. Consider that in your practice, quality what matters, and reducing substandard endodontic treatments. I hope with this strategy you will be able always to remember the factors that contribute to substandard endodontic treatment and do your best to avoid it. Thank you for listening.